Good morning, sir. I am Laline Joy Abarico, third year Bachelor of Science in Nursing, and now I am ready to demonstrate the 12 cranial nerves. Hi, Kessa. I'm Nurse Laline. I'd like to examine the nerve around your face and head. Would that be okay with you?
Yes.
At this point, I'm making observation of the patient to see what I can see any abnormalities in the cranial nerve distribution. This might be something like petosis, strabismus, lack of facial expression, salivation, muscle wasting, and facial asymmetry. The first cranial nerve is olfactory, which is responsible for the sense of smell. So, ma'am, have you noticed any problem with your sense of smell?
No.
Okay. If the patient complains of anosmia and taste abnormalities, this can be explored using a smell testing kit. The second cranial nerve is the optic nerve. The tested components is visual acuity, visual fields, and fundoscopy using the ophthalmoscope. I would test the visual acuity first. If the patient wears spectacles, then testing done with the patient wearing them in order to correct any refractive errors. So, ma'am, I'd like to test your visual acuity. Can you tell me whether you wear spectacles?
No.
No. I'd like you to read something up. Here, take it into your hand and cover your right eye. Could you read the top light?
The nervous system.
Okay. Can you swap hands and eyes?
The nervous
Okay,
system.
that's great. Thank you. A doctor can use a specialist chart, which is likely to be available in special clinic. If you're doing a testing at the bedside, in something with a magazine or a book with a suffice, if you define abnormalities of visual acuity, then you may choose a Snellen chart in order to quantify the defect further. So, ma'am, I'd like to test your visual fields. Could you cover your right eye and your right hand, please? I'd like you to look and concentrate at the center of my eye. I'm going to bring my finger in, and when my finger moves, I'd like you to say yes.
Yes. Yes.
Well,
Yes.
I'm doing this,
Yes.
comparing the patient
Yes.
visual fields with my own. Okay, ma'am, could you swap your eyes now, please? If
Yes.
an abnormalities is detected in visual assessment, by perimetry or center field assessment would be organized. Well, in fundoscopy, it's best to dim the lights in order to allow the pupils to dilate and to ask the patient not to look directly at the dim so that the eyes stays in a fixed position. So, ma'am, I'd like you to examine the back of your eyes using the ophthalmoscope. What I'd like you to do is to look behind me at the clock and focus the clock and not look straight at the light. Please notice for doing this, I'm using the ophthalmoscope for examining the patient's right eye in my right hand, and I'm going to look into your right eye through my hand, right eye. First of all, I will going to examine the red reflex. Now, I'm going to move closer to examine the back of the eye. In looking in the optic, I'm looking at the vessels, and now I'm going to scan the rest of the retina. I'm not going to look in the left eye. I'm going to swap the ophthalmoscope into my left hand and going to examine the patient with my left eye, looking at his left eye. Again, if you could look into the distance, please check again the red reflex and then examine the back of the eye. The next cranial nerve are the cranial nerves 3, 4, and 6 that is usually examined together. Tested components of the ocular movements under pupillary reactions. First, I look at the ocular movements. I check at the normal resting position of the eyes and then at the full range of movement. Okay, ma'am, I'm going to test the movement of your eyes now. What I'd like to do is that you to focus on the tip of my pen. I'd like you to follow with your eyes and keep your heads in. I'd also like you to tell me when you see double at any position. So, ma'am, you just follow my pen. I'm taking the patient eye movements to the extreme of a horizontal first, and then examining vertical gaze. At all stages, I'm looking to see if there's any nystagmus in any particular position. Nystagmus. And now going to test for the movements, the oblique muscles. Okay, ma'am, you didn't see double any of those positions?
No.
I know. Looking at the individual nerves, the abducens innervates the lateral vectus muscles, which are responsible for the abduction of the eye. When the patient has the left sixth nerve palsy, the lateral victus muscles will malfunction. When the patient looks horizontally the left side, the left eye will not abduct normally. Patient will complain of double vision in the images of the horizontally. The trochlear nerve innervates the superior oblique muscles, and its action is demonstrated by asking the patient to look downwards and inwards. With a left fourth nerve palsy, there will be a weakness of the left and superior oblique. When the patient looks downwards and inwards, they will complain of double vision with oblique displacement of images. Because the double vision occurs in looking towards the right, the patient tends to feel that there's a problem with the right eye rather than the left. All of the other eye movements involve the ocular motor nerve. This nerve also innervates vertebrates superior, where weakness resolves in ptosis. In the full picture of third palsy, the pupil will be dilated in the eye with the feet downwards and outwards. Can you follow the pen again, please, ma'am? As the eyes converge, both pupils are seen to constrict. The light reflex involves the perception of the light by the apparent fibers of the optic nerve with the apparent parasympathetic fibers current by the nerve. I'm going to shine a light in your eyes. I'd like you to look out the distance, please. In doing this, I'm going to test the direct and conceptual right reflexes. In the right reflexes, I shine the light in the right eye and the right pupil constricts. I shine the light with the left eye and the left pupil constricts. When testing the conceptual right reflex, I shine the light in the right eye and the light in the left pupil constricts. I shine the light in the left eye and the right pupil constricts. The fifth nerve is the trigeminal that has both sensory and motor components. Light touch sensation is tested in the ophthalmic maxillary and mandibular divisions. And now, I'm going to test the sensation on your face, ma'am. I'd like you to tell me if it feels the same on each side.
Yes. Yes.
The corneal reflex involves afferent fibers from the ophthalmic divisions of the trigeminal nerve and afferent for the facial nerve. If incorrectly, I touch the insensitive sclera, no response. When correctly, I touch to the cornea, bilateral blink responses of oblique. This test is an uncomfortable. It can be omitted if sensory impairment is not suspected. The motor function of the trigeminal nerve is to innervate the muscles of mastications. So, ma'am, I'm going to test your jaw muscle. Can you please clench your teeth tight? Keep clenching. I can feel the temporalis muscle contracting. And again, please. I can feel the masseter contracting. Can you open your jaw now, please, ma'am? The pterygoid muscle open the jaw in the midline. Could you keep it open for me? The pterygoid is strong, and I should not be able to overcome this movement. Can you move your jaw, ma'am, from side to side, please? If the right pterygoid muscle is weak, the jaw will deviate to the right. And if the left muscle is weak, it would be deviate to the left. The next cranial nerve is the cranial nerve of the facial. The facial nerve innervates the muscles of the facial expression and buccinator. Okay, ma'am, I'd like you to test your facial muscle now. Could you raise your eyebrows fully, please? We're looking for the wrinkling of the forehead due to construction of the frontalis muscle, and this should be symmetrical. Now you screw your eyes tight together. For testing the projections of your muscles, an eye should be able to open the eyes. Thank you, ma'am. Can you smile now like this, please? I'm looking for symmetry of the smile and equal actions of the orbicularis oris muscle. Now, can you blow out your cheeks? Like this. This is a function of the buccinnator in muscle. I press gently and see if there's any incontinence of air and skip of air from the mouth. Okay, thank you, ma'am. Next is the cranial nerve 8. The 8th nerve is the vestibulocochlear and has auditory and imbalance function. So, ma'am, I'm going to test your hearing now. Okay, I'm going to cover your one ear and I will whisper the number in the other.
93,
Can you
45,
please tell me what the number is?
93 and 45.
If I detect any hearing deficit, I would move on to the tuning fork test. Okay, ma'am, I'm going to do some tuning fork test. This is the vibrate test. Can you hear that vibrating, ma'am?
Yes.
That is sound loud on one side on the other.
No.
Okay. Okay, that's normal. We're now going to do the Rennie test. Can you hear that vibrating?
Yes.
Okay, ma'am. Could you please tell me when it stops?
No.
Okay. Can you hear that?
Yes.
Okay, that's normal. Rennie test. And now go on to hit the test to the opposite sides. Both of these tests rely on the fact that normally air conduction is better than bone conduction. If air passages are blocked, then air conduction would be reduced, and this is conduction. If the auditory nerve is affected, then both modalities will be reduced, and this is the sensory neuron fields. The next cranial nerve is the vulvar nerves that are conveniently examined. Now, I'm going to test your throat and mouth. First of all, would you give a loud cough, please? This test is the vagus nerve. Now, I'm going to test for the articulation, which involves coordination of tongue, feet, and lips, and requires the patient, the vagus of the hypoglossal. Okay. Could you say the days of the weeks, ma'am?
Sunday, Monday, Tuesday, Wednesday,
What I
Thursday,
like to do now
Friday,
is to
Saturday.
examine the back of your throat. Could you open your mouth for me, ma'am? Okay. Can you say ah? And again, please. Okay. Thank you. That's great. The safe palate should be moved upward essentially to protect the nasal pharynx when the patient coughs. If there is palsy, the soft palate is pulled to the stronger side. The gag reflex is elicited by touching to the posterior pharyngeal wall on each side and results in a gag reflex. It is uncomfortable and not usually tested in the conscious patient. It requires both cranial nerve 9 and 10 for apparent and efferent rules respectively. The cranial nerve 11 is the accessory. The accessory nerve innervates the sternomastoid muscle and the upper fiber of the trapezius. I'm going to test your neck and shoulder. Okay, ma'am, can you shove your shoulder, please? Okay. Very good. And then I'm looking for the symmetrical elevation of the shoulder by the trapezius muscles here. Okay. Next is go to turn your head against my hand. Okay. And I'm looking here at the sternomastoid muscle. If we could do it to the other side, please. When you turn your head the other against my head. Okay. And then, by looking for the sternomastoid muscle. Okay, ma'am? Next is the cranial nerve 12 which is the hypoglossal. Hypoglossal, it innervates the motor supply to the tongue. Now, I'm going to examine your tongue. Do you please open your mouth for me, ma'am? Okay. You protrude your tongue, please. Can you move it from side to side, please? And now, can you push your tongue against my fingers? Do it in the other side, please. Okay, ma'am. That's great. Thank you very much. Thank you very much.
Thank you. Yay mo na.